At Metro Caring, we work to meet people's immediate need for nutritious food while also working to address the root causes of hunger. With COVID-19, we knew, based on conversations with our diverse community, that folks had questions about the COVID-19 vaccine. We knew that we had an obligation as a trusted messenger to create and hold a space. On March 2nd, in coordination with CDPHE, we hosted a Champions for Vaccine Equity virtual community meeting.
So my approach has been first acknowledging missteps that public health may have made, at the national level, missteps that the healthcare system may have made. And I ask people, what would it take to gain your trust? We know that communities of color are disparately impacted by COVID, dying at greater rates. And we also know that the vaccines that we currently have on the market, the Pfizer, Moderna, and the Johnson & Johnson, we are beginning to understand how they might handle the various variants. But so far, all of the data looks good. And so we all have to be scientists, and we all have to look at the data, and we all have to keep up on this. This is sort of a daily endeavor so that we can share what we know with people and to be very transparent. They generally work by teaching our body to recognize specific dangers so that our immune system is prepared to fight them should the virus come our way. Vaccines build immunity, and our goal is to reach herd immunity, that is 80% of the population inoculated, so that we can open businesses and we can return to school. If you've actually had COVID, it would be beneficial for you to get the vaccine because we don't know how long natural immunity lasts. So getting the vaccine prevents you from becoming severely ill from COVID, and it protects all of those around you. If you're immunocompromised, breastfeeding, pregnant, or have chronic conditions, we recommend that you discuss this with your healthcare provider.
I have experienced a little bit more side effect after my second dose, but everything went away in 24 hours. So I think overall my experience very smooth and predictable. I work at a local adult daycare center, so I work with many seniors members a lot, and that's why I recently just got vaccinated. I think for me, getting vaccinated is really important because the community and environment I'm working with. And one thing I can have felt is after everyone get vaccinated, we just felt a lot more comfortable interacting with each other because you have a sense of security now. Of course, we still wear face masks, social distancing, but I think in general, getting vaccinated, it's been something really helpful for them and their mental health and their daily life as well.
This is a new day. We have representation throughout the vaccine development process.
I was not just excited to get the vaccine because as a healthcare provider, I knew that I was coming in contact with kids with COVID, but also because as a Latina, I know that we as a community are at greater risk of complications from coronavirus just because of a lot of the predispositions that we have that have built up over decades of health inequity. And so knew that I really needed to protect myself, and also especially working in healthcare and being at high risk, the last thing that I wanted to do was to bring that virus home to my parents.
Please lean in, have those conversations with folks. Getting the COVID vaccine is the #1 action that folks can take to avoid hospitalization or death from COVID.